Hi, welcome to Gatwick Audiology. I'm Prince Panus. My team and I are here to help you choose the right type of hearing aid for your individual hearing needs. We work very closely with the world's leading hearing aid manufacturers such as Signia, Widex, Phonak, Oticon, Starkey, GN Sound, Unitron and Bernafon. They all try to give you the best quality hearing as possible using their technology. However, they all have certain unique features, unique styles, and we as an audiologist be able to help you choose the right type depending on the hearing loss configuration that you have and also the complexity of difficulties that you may be facing. When I say complexity in hearing difficulties, I'm not referring to their degree of hearing loss. As audiologists, we often classify hearing loss as mild, moderate, severe, and profound. Although these classifications are really useful when we are referring a patient to another medical professional, such as an ENT specialist or their GP, we often find they don't correlate always very well with their hearing loss and the difficulties they may have. For example, somebody with a severe hearing loss, they get on really well with their hearing aids. However, somebody with a mild hearing loss, they may struggle a lot, even with the hearing aid. It all depends on how the sounds are being processed inside their brain. Now, in terms of the types of hearing aids, there are mainly three different types of hearing aids. In the ear type of hearing aid, behind the ear type, and bone conduction hearing aids. So coming to the first one, in the ear, these are custom made hearing aids. Some of them are really small, they fit really deep inside your ear. Most of them work with batteries, and then you have slightly bigger one they call in the canal hearing aids. They are either battery operated or rechargeable. And then the behind the ear type of hearing aid, some of them they come with the thin tubing going into the ear, and also some of them are fitted with a mold, but the hearing aid stays at the back of the ear. And within that second category, we have something called receiver in the ear type of hearing aid as well. Again, the hearing aid sits at the back of the ear, a thin wire goes in, and a receiver sits deep inside your ear. And then the final one is the bone conduction hearing aid. These are not suitable for every patient, depending on their hearing loss and the sensitivity of their inner ear. There are hearing aids that can be connected through the mastoid bone, which sits at the back of your pinna, either through the frame of your glasses or using a little adhesive sticky one called adhere. They're stuck at the back of your ear and the sound will be processed through the bone into the inner part of your ear. Once you purchase the hearing aid from us, you get 3 years of aftercare and warranty as a standard, with the option to extend your warranty and the aftercare for another 2 years for a fee. Within that aftercare package, the assessment you had at the beginning, the hearing aid fitting and the programming, follow-up appointments, and unlimited number of fine-tuning or any appointments you need during that package period is included. Every 12 months, we ask you to come back for another hearing test, and any adjustments required for the hearing aids will be done at that time. Any consumables you may need during that aftercare package period will be supplied free of charge as well. The aftercare element of your hearing aid purchase is so key to ensuring you get the maximum benefit from your hearing aids. We take a holistic approach to your hearing healthcare journey, where we always encourage your significant others in your life to be part of this journey so they understand your difficulties and support you with your hearing needs. In addition to our aftercare package, Gatwick Audiology also provide auditory training for more complex hearing aid users. While the hearing aid technology can get you a clear sound to the brain, auditory training helps to keep up with the conversation, train your brain to comprehend the sound, and manage hearing in noisy environments.